It is critical that when your athletes perform these exercises, they perform them the right way. Now we are going to teach you exactly how to make sure they have good movement quality during the warm-up. The first part of an effective neuromuscular training program is including the right exercises. As you know, we have provided those exercises for you. The second part is doing those exercises the right way. On the screen, you are watching two examples of the same exercise. It takes a well-trained eye to be able to identify which athletes on the screen are performing the exercise correctly and which are performing it incorrectly. This next section of our workshop is designed to help you identify when your athletes are performing exercises incorrectly. We will do this systematically by looking at 3 segments of the body during any exercise or other movement. First, let's evaluate the alignment of the upper body segment. Essentially, we are making sure that the spine is properly aligned. To do this, we must be looking at the body from the side. You will notice that even though the spine has natural curves, when it is properly aligned, we are still able to draw a straight line through the ear, shoulder, and hip. As your athletes go through any practice or game, perform this quick evaluation to make sure that their upper body segment is properly aligned at all times. Second, let's evaluate the alignment of the middle body segment. To do that, we look at the pelvis. The pelvis is the link between the upper and lower body segments. For that reason, having a properly aligned pelvis is a critical component of aligning the entire body. The middle body segment can be evaluated from 2 angles, but we'll start by looking at it from the front. In the pair of photos on the left side of the screen, notice the difference between her positions. In the photo on the left, the green line drawn across the pelvis is horizontal. As a result, her entire body looks much more balanced. Conversely, her entire body looks unbalanced on the right, and her pelvis is anything but level. Now let's look at the middle body segment from the side. Looking at the pair of photos on the right side of the screen, we can see that the pelvis can be tilted in many different directions. Just like the photos taken from the front of the body, we want to make sure that the pelvis looks level in photos taken from the side. An easy way to identify if the pelvis is tilted is by looking for excessive rounding inwards or outwards in the lower back. In the picture on the right, you can see a clear example of the rounding inwards of her lower back. As your athletes go through their warm-ups, practices, and games, perform this quick evaluation to make sure that their middle body segment is properly aligned at all times. The final segment of the body to evaluate is the lower body. This should be done looking at the body from the front. To identify alignment of the lower body, draw a line from the hip through the knee and to the ankle. You can see that on the left, there is a straight line between the hip, knee, and ankle, while on the right, there is not. The alignment of the lower body on the right is concerning. This demonstrates dynamic knee valgus, the risk factor for injuries to the lower body that we mentioned before. Dynamic knee valgus is a risk factor for ACL injuries. As your athletes go through practice and games, perform these quick evaluations of the 3 body segments to make sure that their body segments are always properly aligned. Now that we've covered the evaluation of the upper, middle, and lower body segments, let's practice a bit by looking at a few candid photos of athletes. Look at the volleyball player on the right side of the picture. Because this photo was taken from the front, we will be able to evaluate the alignment of her middle and lower body segments. What do you see? Take a few seconds on your own to do a quick evaluation. Her pelvis looks perfectly level, suggesting that her middle body is properly aligned, at least from this angle. You cannot draw a straight line through her hips, knees, and ankles, which demonstrates that her lower body is not properly aligned. Let's try this again with a new picture. Because this picture was taken from the side, you will be able to evaluate his upper and middle body segments. Take a few seconds to look at this picture and perform a quick evaluation. You cannot draw a straight line through the ear, shoulder, and hip. Although his eyes are looking up, his spine is not properly aligned. You may have also noticed that his lower back is rounded outwardly, demonstrating a poorly aligned middle body. When you compare the poor alignment in the photo on the left to the excellent alignment in the photo on the right, it should become much more clear. We'll try this one more time. What do you see here in this picture? The alignment of her lower body seems close to perfect here. While it is difficult to assess the alignment of her middle body because her arm is in the way, it was easy to draw a straight line between her hip, knee, and ankle. Now let's try making it a bit more challenging by looking at some athletes that are in motion. What do you see now? Keep in mind, you can only evaluate the alignment of her lower body when she is facing directly towards the camera. Watch the video for a few seconds and then we'll pause the video and see how you did. Her middle body appears to be properly aligned. Maybe you noticed that her knees were collapsing in and out during the video, but it is totally obvious once you see a still photo. Oddly enough, this photo shows proper alignment on her right side. However, the left side tells a completely different story. We know that when an athlete's knees move into this knock-knee position, forces on bones, ligaments, tendons, and cartilage increase significantly, which is why it is so important for you to perform this evaluation of your athletes on a regular basis. Let's increase the challenge one more time, this time using the video we watched a few minutes ago. Are you able to identify anyone with poor alignment of the upper, middle, or lower body? Are the girls' bodies stable? Do you see them properly aligned 1 second and in a dangerous position the next? Start by watching just one girl for a few repetitions before moving to the next. Because this video was taken from the front, take note of any reps where you notice poor alignment of the middle or lower body segments. Once you've determined that your athletes are not in the right position, your job is not finished. Next, you need to give them feedback to help correct the issue. Now we're going to go over how to do just that.